Now my privilege to yield to the Honorable Congressman from the great state of Rhode Island, Congressman Gabe Amo.
Thank you, Representative Jackson. Mr. Speaker, I rise today to discuss an issue that is critically important for Rhode Islanders and for all Americans: the need for greater investment in our mental health care system. The topic is timely, of course, especially as we recognize May as Mental Health Awareness Month. Now, here in Congress, we have a duty and a responsibility to act on mental health. We must both reduce the stigma associated with mental health while ensuring that it is both taken seriously and seriously addressed. That's why I'm proud to join my colleagues in the Congressional Black Caucus tonight as we shine a light on the current state of mental health in America. Together, we're committed to reducing disparities in access, expanding coverage for mental health care, and reversing trends that have worsened over the past few years. But first, we must be clear-eyed about the numbers. Right now, 1 out of every 5 Americans is struggling with mental illness. Think about that. These are our neighbors, our friends, our coworkers, our loved ones. And yet, as we acknowledge that mental health conditions are far more common than we think, we must recognize that different communities have different levels of access to treatment. As I've said, 1 out of every 5 Americans lives with a mental illness, a number that remains roughly equal when broken down amongst race and ethnicity. However, despite Black communities reporting relatively equal rates of mental illness, the percentages of them receiving mental health services register far lower than their fellow Americans. Mr. Speaker, it is clear that mental health is an issue that does not discriminate. It does not see color or background, and it affects struggling Americans the same. Yet, access to care is not the same for all Americans. Simply put, the barriers are higher for Black Americans, whether it's because of stigma for seeking help or lack of accessible and affordable providers. It's clear that we must do more to bring down those barriers. After all, if we are to live up to the words of our founding document, life, liberty, and the pursuit of happiness, then we must close the racial disparities in coverage and treatment, particularly as Americans are experiencing rates of loneliness so high that the Surgeon General has declared it a public health crisis. Congress must lead by example. To that end, I'm proud to lift up legislation that would expand investments for mental health in schools and reduce racial gaps in treatment. I thank Congresswoman Bonnie Watson-Coleman for her leadership on this second point. However, I'd be remiss if I didn't mention my home state of Rhode Island as a model to be aware of. Thank you to the work of committed nonprofits like the Mental Health Association of Rhode Island and the National Alliance on Mental Illness Rhode Island. Our state was recently named the 5th best state for mental health care in America, but that's not enough. Over the past year, we've seen enormous progress on this front due to increased state-level advocacy and initiatives that ensure and increase access. And yet, as we highlight these protections being codified into law, we must keep our efforts to closing the equity gaps in our system. Every American, no matter the color of their skin or the background that they come from, deserves to lack that dignity, that respect. Every patient, regardless of what they are struggling with, deserves the support and services they need to live their best lives. By asking and listening to each other, by arming ourselves with the facts, and by using them to push for greater access to care, we can make a real difference in the mental health out of all Americans across our country. So I thank my colleagues again for their leadership and for hosting this critical special order tonight. Representative Jackson, I yield back.